Thank you, Dr. Rowling, for that lovely introduction. As she said, my name is Rachel, and I'm excited to be here with you all today. We will be talking about AI and Perio. I hope you can own the change to become empowered. I started 30 years ago in the dental field. I began as a dental assistant working with 2 periodontists. This developed a passion for dental hygiene, and I graduated from Indiana University in 1997. I spent 25 years as a clinical dental hygienist. 3 years ago, I transitioned to a dental hygiene consultant role at Denti.AI. I manage clinical training and educational development. I'm currently pursuing a master's in dental hygiene at the University of Michigan. My focus is expanding knowledge and education and clinical practice, and I'm excited to share these innovative AI tools with you today. To help you explore AI's benefits further, I've included QR codes in this presentation. When you scan these with your phone, they will direct you to websites and articles that provide more in-depth information. Let's embrace this transformative technology together and continue advancing the future of dental hygiene. For our learning objectives, we will examine how we need to rethink periodontal disease, review oral systemic links, define periodontal disease classifications. I hope you can attain an understanding of AI in dentistry, illustrate AI applications in Perio, explore dental AI products available, and recognize the impact AI has on Perio and the future of dentistry. This is my disclosure. Here is our agenda. And most importantly, here is how to obtain your CE credits. These will be announced at the end of the CE webinar. Included is our course summary. And to begin, I just want to share our dental hygiene oath. It's probably been a while since some of you have heard this or read this. In my practice as a dental hygienist, I affirm my personal and professional commitment to improve the oral health of the public, to advance the art and science of dental hygiene, and to promote high standards of quality care. I pledge continually to improve my professional knowledge and skills, to render a full measure of service to each patient entrusted to my care, and to uphold the highest standards of professional competence and personal conduct in the interest of the dental hygiene profession and the public it serves. Periodontal diseases can no longer be considered simple bacterial infections. They are much more complex and multifactorial. They involve an interplay of subgingival microbiota, the host immune and inflammatory responses, and environmental factors. We need to see this as a holistic approach. Effective management requires evaluating and addressing all contributing factors for optimal oral health, restoration, and maintenance. We need to look at the whole body. What determines periodontal health? There are so many factors at play here. The first ones that we're going to look at are microbiological determinants. Plaque and biofilm buildup from bacteria is the leading cause of periodontal disease. Bacterial transmission and colonization require a susceptible patient and a suitable environment. Let's take a look at the periopathogens. There is the orange complex. These are the early stage pathogens that disrupt bacterial balance and initiate the disease. We have purple complex. This bacteria can cause cell death and manipulate inflammation, contributing to disease progression. There's also red complex. These are highly inflammatory pathogens that damage gum tissue and accelerate disease development. We also have the green complex, and these are persistent bacteria that contribute to ongoing gum tissue destruction. Understanding these complexes help us diagnose, prevent, and treat gum disease for optimal oral health. Host factors include genetics, immune function, and overall health. Let's look at some of the local predisposing factors. This could be tooth position, root anatomy, dental restorations, and even periodontal pockets. Irregular or complex root shapes can trap plaque and bacteria, promoting periodontal disease. Overhanging restorations can harbor plaque and bacteria, worsening periodontal disease. If a patient has crowded teeth, this makes brushing and flossing difficult, leading to trapped food particles. By recognizing these local factors, it helps us to prevent complications and support long-term periodontal results. Let's look at the systemic risk factors. These impact the management of periodontal disease, so it includes cancer, obesity, metabolic syndrome, cognitive impairment, even pregnancy. Cardiovascular disease and diabetes are actually key contributors. Cardiovascular disease is linked to high mortality rates, and diabetes has a bidirectional relationship with periodontal disease, and high A1C levels impair immune function, increasing susceptibility to periodontal disease. We also need to look at environmental determinants. So smoking weakens the immune system, and this increases gum disease and tooth loss risk. Even vaping, while it's less harmful, it still exposes gums and enamel to nicotine and chemicals. Chronic stress can lead to harmful habits and reduce saliva, making gums more susceptible to infection. Some drugs may cause dry mouth or gingival overgrowth, bleeding, or damage to periodontal tissue. This heightens oral health risks. A balanced diet promotes periodontal health, whereas an unbalanced diet really is detrimental to periodontal health. This supports overall health, and it includes managing chronic conditions like diabetes. So a balanced diet is very important. Recognizing these environmental determinants, we can work together to implement strategies to improve oral health outcomes. Educating patients on the impact of lifestyle choices, stress, medications, nutrition, it's essential for promoting better oral and overall health. This leads us to rethinking periodontal disease. Did you know that over 50% of adults over the age of 30 suffer from some form of periodontitis? And this number rises to 70% for individuals over 65. This is a significant health concern. And we as dental hygienists, we have this unique opportunity and responsibility to make a difference. It's time for us to take ownership of this issue and become powerful agents for change. We must actively engage in raising awareness, improving prevention strategies, and advocating for better periodontal health care. The time to make the change is now. Unfortunately, studies show that in many offices, only 16% of patients have complete periodontal records. And I will add that my experience in my current position confirms this. What shows up in most offices and DSOs is that many dental hygienists are not performing regular periodontal charts. And this might be why. In a 1-hour appointment, we balance assessments, treatment planning, and patient care, and this can impact the number of procedures we have time to complete. We're not just treating the mouth. Periodontal disease is the second leading modifiable contributor to systemic inflammation after obesity. It's modifiable. And thorough periodontal evaluations are crucial, even when time is tight, as early detection improves both oral and systemic health. By addressing periodontal issues early, we can significantly enhance patient outcomes and overall health. Please, let's stay focused and make an impact on lasting change and patient overall well-being. Enter the 2017 Multidimensional Staging and Grading Framework for Periodontal and Peri-implant Diseases. This new system was based on 20 years of research, improves diagnosis and treatment of periodontitis. It helps classify patients in a way that explores how periodontal treatment can influence systemic diseases. This was meant to improve our understanding of disease progression and risk factors in treatments, and it emphasizes the complex nature of periodontal disease and underscores the importance of individualized treatment plans. So in this, each patient is unique, and their care should reflect that. So tailoring our approach to the specific needs of patients will lead to better outcomes and more effective oral health management. So let's break this down. We're going to look first at pristine oral health. And in its ideal form, this is defined as the absence of histological evidence of periodontal inflammation and no signs of anatomical changes to the periodontium. However, it is important to acknowledge that in most, if not all adults, achieving this level of periodontal health is unlikely. This reinforces the need for a proactive, individualized approach to managing periodontal health, as most patients will have some degree of inflammation or structural change, right? Most often, we may run into clinical periodontal health. So this is no inflammation, no redness, no swelling, no edema, no pain. It refers to the absence of all of this, and it's an anatomically intact periodontium. It's a healthy periodontium where the supporting structures, like the gums, the periodontal ligament, the cementum, the alveolar bone, they're all intact and they show no signs of inflammation, no bleeding on probing. Next, we are going to look at periodontal health on a reduced periodontium. This occurs when there's been some degree of damage or loss, either from ortho, trauma, or even periodontal disease. So with no history of periodontitis, these are our patients that have recession, but we have to get historical. We have to make sure that there is no perio in their past. This could be recession from ortho, from trauma, from crown lengthening, or any non-perio related condition. We can also have successful treatment of periodontitis. And after successful treatment, the remaining tissues can stabilize. And as long as that inflammation is under control and the periodontium remains in a state of health, we can consider these patients periodontitis or periodontal health on a reduced periodontium. So basically, these would be our stable perio cases. The 2017 workshop focused on clarifying unresolved issues from the previous classification system, particularly for gingivitis. So it distinguishes now between the presence of gingival inflammation at one or more sites between an actual case of gingivitis. So it is better to have it classified this way, right? So we can have it as a true gingivitis patient, or just isolated cases of gingivitis within a patient's mouth. So there's dental biofilm induced and non-dental biofilm induced. Let's look at biofilm induced first. So this is associated, of course, with biofilm. It's mediated by systemic or local risks, and it can also be caused by drug-influenced gingival enlargement. Gingivitis with diseases that are non-dental biofilm induced, that would be your genetic or developmental disorders, your neoplasms, specific infections, any inflammatory or immune condition, gingival pigmentation, lesions, that sort of thing. How many times do we have patients say to us, "What do you mean you can't just clean my teeth today?" We now have this lovely code that is the D4346 code, and it is scaling in the presence of generalized moderate or severe gingival inflammation. This code is a therapeutic code. It is not a preventive code. To use this code, you have to be able to show that you have 30% bleeding and absolutely no radiographic bone loss is present. And the code is limited to once every 2 years. Now let's look at periodontal disease. First, we're going to touch on necrotizing periodontal disease. This can include gingivitis, necrotizing periodontitis, or necrotizing stomitis. The necrotizing diseases can affect small areas of the mouth and progress rapidly. So they come on suddenly, it's excruciating pain, and it can radiate to other areas of the mouth or face, making it distinct from more chronic periodontal diseases. A lot of times this shows up in young adults, malnourished children, immunocompromised individuals. We also have just periodontitis. We need to investigate. We need to perform a differential diagnosis to determine what the history is in the specific presentation. Is it necrotizing periodontitis? Is it something from an immune response? We need to look at the risk factors. We need to diagnose it as periodontitis and classify it using staging and grading. So what is periodontitis as a manifestation of systemic diseases? Periodontitis has a multifactorial etiology involving genetic predisposition, bacterial infection, immune responses, environmental factors, and even systemic diseases. The interaction of these factors, rather than a single cause, contributes to the development of periodontitis. We need to effectively manage the disease based on the severity and systemic conditions, and we need to require patient compliance, and it requires a comprehensive approach. Systemic conditions such as diabetes and cardiovascular disease can exacerbate periodontitis by affecting immune responses and inflammation. More than a third of periodontitis cases are linked to systemic diseases, highlighting the importance of both managing periodontal health and overall health for better patient outcomes. Let's look at other conditions. So what other conditions affect the periodontium? We have periodontic abscesses and endodontic periodontal lesions. Periodontal abscesses typically occur in pre-existing periodontal pockets where bacteria accumulate, leading to a localized infection. The treatment usually is draining the pus. You clean the affected pocket, sometimes surgically. You remove the infected tissue and you reshape the gums. I did a lot of help with that and assisting with that when I worked at a periodontal office. It's also crucial to address any underlying periodontal disease to prevent reoccurrence. What about other mucogingival deformities, traumatic occlusal forces, and prosthetic-related factors? So this is a lack of keratinized tissue and gingival recession. It could even be the frenum position. The traumatic occlusion happens when misaligned teeth bite and cause injury through these forces, and it leads to tissue damage. Dentures should be removed regularly for cleaning because prolonged wear without removal can irritate the tissues, and this leads to inflammation and infection. Let's look at the implant diseases and conditions for a minute here. What denotes peri-implant health? Upon visual inspection, rule out any signs of inflammation. The tissue should be firm and pink. There should be little to no bleeding on probing, and there should be an absence of further bone loss following initial healing, which means less than 2 millimeters. There is also reversible peri-implant mucositis. This is shiny, swollen, inflamed tissue. This is our gingivitis of the implant world. There's a local dot of bleeding that isn't from probing. Any bleeding on probing that's accompanied by a visual inflammatory change. Separation upon probing or gentle tissue pressure can happen as well. But the nice thing is this is reversible. As long as it hasn't gotten into the bone, the implant mucositis is reversible. However, we do need to watch out for peri-implantitis. This is irreversible but treatable. This is a visual inflammatory change in the peri-implant tissues. There's bleeding and separation on probing, there's increased pocket depths, and there's progressive bone loss in relation to the radiographic bone level assessment after 1 year. Let's move on to staging and grading. It's best if we can break stage 1 and stage 2 into their own side and then separate them from stage 3 and stage 4. So for stage 1 or stage 2, we need to confirm clinical attachment loss, and we need to determine radiographic bone level. And then we need to also rule out, again, non-periodontal causes of clinical attachment level, right? Not all of our patients need to be staged and graded, just our perio patients. We can still have that healthy patient that has clinical attachment loss from occlusal trauma or ortho or crown lengthening. Stage 1 and Stage 2 are considered early to moderate stages of periodontal disease. Typically, we treat these patients in-house. We do SRPs, which helps remove the plaque and the tartar below the gum line. It reduces inflammation, it promotes healing, and it's usually the best way to address Stage 1 and Stage 2. Once we get into Stage 3 or Stage 4, we still confirm clinical attachment loss. And then also there's going to be more RBL patterns, radiographic bone loss patterns. Also in these stages, we need to assess tooth loss due to periodontitis, and these are more complex cases. These stages represent a more advanced form of periodontal disease where there may be significant attachment loss in deeper pockets. Referral to a periodontist is often recommended for better treatment outcomes. And what do these stages look like clinically? So the top picture is a Stage 1 patient. So there's 1 to 2 millimeters of clinical attachment loss, less than 15% bone loss, and there's no tooth loss due to periodontal disease. Stage 2, in that second picture, it's more moderate, 3 to 4 millimeters clinical attachment loss. Stage 3, in that third picture, is more severe. There's potential additional tooth loss, and then Stage 4 encompasses all of Stage 3 with additional features. We also need to look at the grade, and this image provides a guide for grading periodontal disease based on bone loss percentage. Clinicians can assess the bone height relative to root tooth length or total visible bone on radiographs to calculate bone loss percentage. Now that the grading, note that grading is subjective. It's influenced by X-ray quality, image clarity, and clinician experience. In this case, the patient's bone loss is graded as a C, indicating moderate to severe periodontal disease. We also need to look at the risk factors, which are smoking and diabetes, and we've even added cardiovascular disease. So with these risk modifiers, periodontal disease may progress more aggressively, requiring tailored treatment plans to include smoking cessation, diabetes management, more frequent monitoring. We should adjust care plans to address these factors and improve patient outcomes. Let's look at a decision tree. I think these are very helpful, especially when we're taking all of this information and trying to determine the best course of action for our patients. This will help standardize care. It helps standardize treatment protocols, ensuring consistency and reducing variability in patient care. And incorporating decision trees into clinical practice can help dental hygienists and clinicians navigate more complex cases effectively. So this will provide patients with personalized, high-quality oral health care. How do we gather all the info we need properly to classify, diagnose, and treatment plan? Because we cannot classify our patients until we assess them. We need a complete periodontal disease assessment. To provide the best care, it's essential to consider the full patient history. Here's what we need to look at. We need to check the medical history. Look for any past conditions, medications, or surgeries that might impact oral health. We need to look at the dental history. Has the patient had any periodontal issues in the past? Have they had ortho in the past? What about their social history? Is the patient a smoker, a vapor? These habits we have seen can significantly affect gingival health and healing. Even their mental health, conditions like depression can affect oral health care routines and leading to neglect. Their nutritional history, because we know diet plays a big role in oral health, and poor nutrition can lead to gum disease and decay. By gathering all of this information, we can create a more personalized treatment plan that addresses not just the teeth, but the overall health of the patient. This holistic approach leads to better outcomes. Self-care is the new healthcare, and as dental professionals, we know that self-care is a cornerstone of good oral health. It's about more than just keeping teeth clean. It's essential for preventing dental diseases, supporting accurate diagnoses, and ensuring effective treatment. When patients practice high-quality self-care, it makes our jobs easier. Clean, healthy teeth give us a clearer, better picture, helping us spot potential issues early and provide better care. Good self-care also helps prevent conditions like gingivitis and periodontitis from worsening, allowing us to manage problems more effectively. Encouraging patients to maintain a consistent, thorough oral care routine not only protects their smile, but also supports their overall success of their treatment plan. It's all about teamwork. Patient self-care, professional care, we work together for optimal outcomes. The traditional clinical assessment remains the foundation for how we diagnose perio. So when capturing the data on a perio chart, it's important to ensure thorough documentation. This helps for monitoring disease progression, guiding treatment, and tracking changes over time. Although it may feel overwhelming given the amount of detail required, thorough charting is essential for accurate diagnosis and effective care planning. Here's a breakdown of what should be captured. So, full perio charting, including the data points by location, severity, quality, written description, probing depths, bleeding points, separation, mucogingival relations, defects, recessions, attachment level, and loss. So we should also take note of the presence, degree, and distribution of plaque and calculus, the gingival health, the disease that's there, bone height, bone loss, mobility and fremitus, presence, location, and extent of furcation involvement. So this is a lot of information, right? This is a lot of perio. I've given you a fire hose of periodontal information in 26 minutes. So what do we do with this? Can AI help with any of this? Let's look at that. First of all, let's discuss what is artificial intelligence. Artificial intelligence is machines' ability to perform cognitive functions similar to human minds, including perception, reasoning, learning, interaction with the environment, and problem solving, and even creativity. At its simplest form, artificial intelligence is a field which combines computer science and robust data sets to solve problems. You may be using AI and not even realizing it. So, in the people you know on Facebook or on LinkedIn or even on Instagram or Alexa, even when you watch Netflix, or if you're waiting to chat with someone at Home Depot, even your car has AI. Let's look at dental AI company considerations. When evaluating dental AI products, consider the following factors. Look at integration and compatibility. Is the AI product you're adding onto your systems, or does it require an additional step to save to your practice management system? For the pricing structure, does the pricing model charge per operatory, per user? Make sure you understand the cost structure, and it's essential for budgeting and scalability. Look at the training and onboarding involved. What type of training is provided? Options may include on-site training, live virtual training sessions, or even an online learning management system. Either of those are great, but make sure you understand that there will be training involved and know what you're getting into. And it's really important because adequate training is crucial for maximizing the benefits of the AI system. What about customer support? What level of customer support is available? Consider whether support is immediate or if you might experience long wait times, as prompt assistance can be critical for maintaining workflow efficiency. Taking the time to assess these key factors will ensure that you choose a dental AI product that aligns with your practice's needs and enhances operational effectiveness. The dental profession is on the brink of a technological revolution, with AI offering powerful opportunities to both enhance practice management and efficiency and patient care. By integrating AI into daily workflows, dental professionals can streamline operations, improve precision, and provide personalized treatment. It's important to note that AI is not meant to replace dental expertise. It's meant to complement the skills of the dental team, especially dentists and dental hygienists. By embracing AI, dental hygienists and dentists can continually expand their knowledge and refine clinical skills, adopt new evidence based techniques to advance the profession, deliver more personalized care, improving patient outcomes, and integrate AI into your practice keeps you at the cutting edge, positioning you as a leader in dental care. Adopting these technologies not only enhances your practice, but it shapes the future of dentistry. Take the next steps to embrace AI to transform patient care. We are only going to touch on a few things today for AI, but AI algorithms can be used to detect periodontal disease, tooth movement, oral cancer, tooth decay. It has the potential to significantly improve patient care and treatment outcomes by minimizing human error. As AI continues to transform the dental industry, one of the most notable advantages in it is in its ability to process and analyze large amounts of data quickly and accurately. This capability enables dental professionals to access valuable insights, which can greatly enhance decision-making processes and lead to more informed, precise treatment plans. We've already talked about peri-implantitis, but it's a condition where the tissue and the bone around the dental implants gets infected. Right now, we have no reliable way to predict how patients will respond to treatment. Researchers at the University of Michigan of Dentistry are working on an exciting solution. It's an AI-powered machine learning algorithm called FARDeep. It stands for Fast and Robust Deconvolution of Expression Profiles. This tool helps predict the success of regenerative treatments for peri-implantitis by analyzing samples from patients. FARDeep looks at harmful bacteria and immune cells in the tissue, which are key to fighting infection. By doing this, it can forecast how the tissue will respond to treatment, giving clinicians valuable insights into what to expect from regenerative therapy. In the future, FARDeep could even help predict the risk of peri-implantitis before the patient gets to the implant stage, allowing for more personalized and proactive treatment plans. While more clinical trials are needed before it can be widely used, this is a big step forward in using AI to improve dental care. An exciting new AI algorithm is making strides in identifying different risk profiles for gingival inflammation and periodontitis, especially around the age of 35 when the risk of developing these conditions tends to shift. By combining machine learning with advanced explainability algorithms, this approach gives us a deeper understanding of how systemic factors influence periodontal risk. What's promising is that this tool can help dental professionals pinpoint transition points where a patient's risk may change, leading to more accurate, personalized predictions for periodontal health. This opens the door for more proactive care and targeted treatments, ultimately allowing clinicians to intervene earlier, provide better tailored solutions for their patients. And we talked about microbiological determinants of periodontal disease. What about AI salivary testing? The use of AI in salivary biomarker research is most prominent in the validation of biomarkers for diseases like dental caries, oral cancer, and periodontal disease, primarily through supervised learning models. So this is a fantastic, we're just beginning to touch the tip of the iceberg with all the stuff that AI can do. But salivary testing needs more studies, but it's looking promising. What about AI-driven clinical chart notes? These are instant clinical notes from any patient encounter. It automatically updates the patient dental records. It retains the clinical truth of every encounter. Share patient-friendly notes after your consultation and ensure patients stay engaged in their oral care. This gives us a more comprehensive look at clinical chart notes. I know for me, if I would start at 8 o'clock in the morning and have patients, by the time I got to noon, I'd have to remember what my 8 o'clock patient and I talked about. And It's hard, right? So if we have AI-driven notes, this is a way to get more accurate, more complete chart notes. Smart toothbrushes and AI are changing the game in oral health, offering exciting new ways for patients to improve their care. This has been shown to give better treatment compliance, improved oral health, reduce plaque and debris accumulation, and enhance periodontal health. Excuse me. Many toothbrushes feature pressure sensors that alert users when they're brushing too hard, and this helps to prevent gingival and enamel damage. These sensors provide real-time feedback, ensuring patients maintain the proper brushing technique. AI-powered apps take things further by allowing users to capture high-resolution images of their mouths, tracking changes in oral health studies over time. Studies show that patients using these apps after periodontal treatment had better compliance, improved oral health, and reduced plaque buildup. These apps can also integrate with electronic health records, making it easier for dental professionals to monitor patient progress and outcomes. This seamless connection helps both dental clinicians and patients stay on top of oral health. As a dental professional, it's important to stay informed about these advancements because many patients are already using these tools. So we have an opportunity to educate them on how to make the most of this technology to enhance their oral care. AI voice-activated periodontal charting is a game changer in dental technology, making documentation and patient care faster and more efficient. And here's how it works and the benefits that it offers. With voice-activated periodontal charting, dental hygienists can use voice commands to record findings during patient examinations, eliminating the need for manual input. The speech recognition software understands specific dental terms, allowing us to say things like pocket depth, bleeding, mobility, and furcation involvement. Once spoken, it transcribes it into the Perio chart. So it's assistant-free. We love our assistants, but they have much better things to do than to stand there and input numbers for us while we're doing a Perio chart. It can enhance the patient experience because now the patient will hear you call out numbers and they can be involved in their oral care. This streamlines periodontal charting. This will adapt to anyone's unique voice. This is not the old ones that we had to train, right? Some of the old systems we had to train to listen to our voice. It doesn't matter because it's AI based. It will adapt to anyone's unique voice, anyone. Yeah. It directly charts to practice management systems. It can increase the time to focus on patient care. You can generate health summaries at the end for patient education. And it also promotes proper infection control and ergonomics, right? You're not turning around having to touch your keyboard. What about radiographic bone loss? What you're looking at here is AI-powered tool analyzing radiographic bone level. The AI calculates the amount of bone loss around a specific tooth, then presents this information as both a percentage and in millimeters. Additionally, the pop-out box displays all the images that contain the specific tooth, providing a comprehensive view of the data and visual references for more accurate assessment. Plus patient education, the patient can see this as well. The most accurate way to assess bone loss is by examining radiographic bone level, which is visible in the x-rays. This gives a clear indication of how much bone has been lost between teeth, which is crucial in determining the stage of periodontal disease and the need for specialized care. This tool helps enhance diagnostic accuracy and treatment planning by offering precise, measurable insights into bone health. And as you can see here, I don't know if you can see it, but this says periodontitis stage 1, so it will also add staging onto the radiographs. A groundbreaking study revealed that, A groundbreaking study revealed that artificial intelligence can detect signs of periodontal disease in dental images with remarkable accuracy. In this study, 2 experienced periodontists used traditional methods, so regular probing, checking gingiva, checking x-rays, looking for bleeding, deep pockets, without knowing what the AI detected. Meanwhile, the AI was trained to look for key signs of periodontal disease, such as gingival inflammation, calculus buildup, deep gingival pockets, and all from intraoral images. And yes, intraoral images. So the little camera, just intraoral images. The results? The AI performed incredibly well with high sensitivity, accurately identifying disease, specificity in avoiding false positives, and overall accuracy. So it was 87% accurate in diagnosing periodontal disease. 90% of the time, it correctly identified periodontal disease, and 86% of the time, it had an overall accuracy compared to clinical diagnosis. So matched up against clinical diagnosis, it was right 86% of the time. This means AI can be just as reliable, if not more, than traditional methods for diagnosing periodontal disease from images. This is a huge leap forward for periodontal care, offering faster, more accurate, and more accessible diagnosis. The future of dental health is looking brighter than ever with AI. Radiographic AI is a game changer for dental professionals, offering a powerful way to spot early signs of tooth decay with incredible precision. It can also automatically chart restorations, which helps save time and reduces the chance of errors. Accurate dental charting is really important because missing even small details means we don't have accurate charting. With AI, you can rest assured that every important piece of information is captured, making your work both more efficient and thorough. But that's not all. It also enhances your ability to diagnose conditions and makes it easier to explain findings to your patients. This boosts their trust in your expertise and treatment plan, strengthening the relationship between you and your patients. In short, AI is not just a tool to improve care, it also helps connect you with your patients on a deeper level, creating a more confident and an informed experience for every patient. And it's going to save you time. You can update your patients of record, and you can accurately identify existing restorations. AI is becoming a vital tool in radiology in the medical field, helping radiologists reduce eye fatigue or gray fatigue, they call it, from looking at images all the time. We look at images all the time. We also have gray fatigue. This causes us to miss important abnormalities on x-rays. Have you ever come across something unusual in an x-ray that you hadn't noticed before? We all have, right? It's a common experience, but it raises the question, how much have we missed in the past? This is where AI can really make a difference. With its ability to analyze images with incredible precision, it can highlight potential issues and give the dentist and us an extra set of eyes, ensuring that there's no critical detail that's overlooked. It's like having a safety net that helps improve diagnostic accuracy and efficiency, allowing us as healthcare professionals to focus on what we do best. Wouldn't it be great to have that extra support? So you can analyze the radiographic images, identify abnormalities. It will assist in the detection of dental diseases. You can locate and classify dental caries. You can measure radiographic bone level. And even better, it's colored. It's on your screen and it's colored. So no more do you have to show your patient, well, I'll show you this on the next screen. Let's go to the next screen. So what do you see? Here's your chance. Think about how you would normally show this to a patient. How would you point out areas of concern? If it were me and I was looking at this image, I would look at this and say, oh, Mr. Jones, do you see that dark gray area there on this tooth right here? Yeah, that's an area you need to look at. But it's hard, right? The patients don't always know what we're talking about. Let's look at what it could be. So how did you do? How nice would it be to have all of these areas outlined in red? Even better, there's also a setting where you can close in those boxes and it turns in what I call little red blobs. And it's so nice for patient education. I can show this to my patient and say, oh, Mr. Jones, do you see this little spot here on this tooth number 30? He may not know what tooth number 30 is, but he's going to see that red spot there, right? According to FDA studies, a dentist's clinical judgment plus AI will yield 15 to 30% more accurate findings. So AI isn't here to replace clinical judgment. It's meant to be a helpful tool, like a co-pilot. Think of it as an extra layer of support that enhances your abilities, not takes over your expertise. When you combine your knowledge and experience with AI's powerful capabilities, you become even more effective at diagnosing and treating and educating patients. It's all about using the best of both worlds, your skills, your clinical knowledge, and the technology's precision. Together, you plus AI equals better outcomes for everyone. AI is designed to improve our workflow, but it's important to keep in mind some key challenges. We need to be aware of potential biases, limitations, and ethical concerns that can arise with this technology. For example, if you have outdated equipment or a lack of system updates, that might make it harder to fully integrate AI into practice. If it's not up to date, the effectiveness can be compromised. Also, without proper education and training, dental clinicians may find it difficult to adapt or even misuse AI. That's why ongoing learning is essential to ensure we're using it to its fullest potential. Another thing to consider is bias in AI studies. If research is conducted with a narrow or unrepresentative population, the AI might not work well across all patient groups. There's also automation bias. This is another risk. This happens when dentists or hygienists start to see AI as perfect and let it overshadow your own clinical skills and your critical thinking. Again, AI should be a tool that supports, not replaces your clinical judgment. What is the most important expectation? Dentists and dental hygienists must be open to change. AI is revolutionizing dentistry by improving patient care, efficiency, and outcomes. Here's more ways how it's making an impact. We barely scratched the surface today. Treatment planning, it can analyze medical history, lifestyle, genetics, create personalized treatment plans. Predictive analytics, it can review historical patient data, predict future dental issues, enable early intervention. Patient communication through chatbots and virtual assistants. It can streamline scheduling, answer questions, and send reminders, improving engagement while reducing administrative work. There's also robot-assisted surgery. I've seen it in action. There's AI-driven robotic systems for root canal therapy. They can provide real-time feedback during surgeries. They can enhance precision and minimize human error. Even in education and training for clinicians, there's AI simulations that simulate clinical scenarios, especially post-COVID, right? This is a great way to help students and professionals practice and learn through real-time feedback. Post-treatment monitoring. AI tracks healing progress through follow-up imaging, mobile apps, alerting professionals if further treatment is needed. Even insurance claims, automating those with AI. Even electronic health records, they can seamlessly use these AI tools to provide a comprehensive view of patient care. The future of dentistry is bright, with AI enhancing daily operations and shaping the future of oral health care. These are insights from Dentally.AI's recent survey on how AI is transforming dentistry. It highlights the growing role of AI in shaping the future of dental care, capturing both dentists' and patients' perspective on its impact. The survey shows that 35% of dentists are already using AI in their practices, with adoption expected to rise over the next 5 years. The shift has been gradual, but dental professionals are recognizing the benefits, such as improved workflow, better diagnostic accuracy, predictive analytics for patient outcomes, and more personalized treatment outcomes. Patients also view AI in dental care positively, appreciating its potential benefits. And remember, they're getting AI in the medical field as well. Concerns do remain about reduced human interaction during AI-assisted procedures and costs of AI-driven treatments. However, despite these reservations, the general consensus is that AI has a great potential to transform dental care. That's from the dentist and the patient's perspective, but what about the dental hygienist? I love this 2024 survey from ADHA and Heartland. They did perceptions of AI in dental hygiene. It was conducted by the ADHD and Heartland, and it highlights how dental hygienists are embracing AI and its potential to transform their work. Key findings here include increased optimism, with many hygienists excited about using AI for tasks like diagnostics, treatment planning, perio charting, and patient communication. A significant number believe that AI can streamline workflows by automating routine tasks like charting and data management, allowing more time for direct patient care, which boosts both satisfaction and patient outcomes. AI is also seen as a tool to enhance patient care by improving diagnostic accuracy and enabling personalized treatment plans. Many hygienists recognize the need for ongoing education to integrate AI effectively into their practice. And while there are concerns about changes and losing personal interaction with patients, most see AI as a complement, like I've said, not a replacement. It's always you plus AI. The survey emphasizes that as AI evolves, it will help reduce time spent on administrative tasks, enabling hygienists to focus more on patient care and contribute to the future of oral health care. In conclusion, AI is already making waves and revolutionizing dental workflow, but we've only just begun to tap its full potential. While studies on AI's direct impact in dental hygiene are still emerging, the possibilities for improving patient care are incredibly exciting. AI can enhance every aspect of the dental practice, from diagnosis to treatment planning to patient education. Increasing awareness of AI's capabilities among both clinicians and patients, we can unlock smarter decision making and more accurate data for everyone. Now is the time to explore how AI can transform our profession. Let's embrace this technological shift, refine our skills, and work together to elevate care, both in the office and at home. The future of dentistry is bright, and it's our time to lead the way. Let's harness AI's power and set a new standard of excellence in patient care. Thank you. Are there any questions?